Hi, I'm Lieutenant Traeger, a social work intern at Womack Army Medical Center in Fort Bragg, North Carolina. Over the past 60 days, our previous daily routines either no longer exist or have been modified to adapt to the changes due to COVID-19 global pandemic. Business operations and hours have changed or closed altogether. Schools have shifted to electronic platforms. Social isolation and travel restrictions may have strained personal relationships, restricted vacations, or impacted other recreational activities that previously served as outlets. Additionally, some of our coworkers have been in contact with family members, coworkers, and/or patients who have tested positive for COVID-19. These are all factors that can contribute to increased stress levels and heightened stress responses. As healthcare professionals, you likely stay focused on providing good care to your patients and may place your own well-being aside. It is important that during this pandemic you continue to practice good self-care skills. If you or your colleagues are experiencing increased stress levels, you may notice a change in emotional, physical, or cognitive states. It is important to know your colleagues in order to be able to identify any of these changes. Indicators that a person might be experiencing higher than usual stress levels include, but are not limited to, you may notice becoming easily frustrated, agitated, or moody. You might feel overwhelmed or like you're losing control, or have difficulty relaxing and quieting your mind. You may also find yourself feeling bad about yourself, lonely, worthless, and hopeless. You might avoid others. You might experience low energy or headaches, upset stomach, or you may feel different aches, pains, tense muscles, chest pain, increased heart rates. You may have trouble sleeping, have poor focus, poor judgment, and seeing only the negative side. It is perfectly normal for us to experience varying levels of stress, but it is equally important that we know and use self-care skills to reduce the effects of stress and to prevent provider burnout. Some self-care tips and good practices include, but are not limited to, ensuring you get enough sleep, nutrition, water, and exercise. Make sure you're pacing yourself and taking regular breaks while you're working. You can also conduct check-ins with team members. This lets them know that you care about them. Let your co-workers know when they're doing well. People need positive feedback because, again, it lets them know that you are noticing them and they are feeling cared about. Next, you can make or schedule time with your family, whether it's a family night, exercising, cooking, etc. You can get creative, turn your home into a hotel, camp in your backyard, or conduct small science experiments. Also, ensure you get outside regularly for some fresh air and a change of scenery. You can try to establish a new routine. Also, don't forget to stay in touch with those family members you're used to seeing. Try to use a video platform to talk to them, as it affects us differently to see our family members. It helps to alleviate some of the stress from social distancing. Be creative and try something new. Many museums are offering free online tours. Gyms and individuals are offering free workouts or work-ins available through their social media platforms. And importantly, focus on things within your control. Simply recognize that everything exists, but there's not really a lot you can do about it. Also, identify the positive or good aspects of the situation. Everyone responds to stress in different ways. There is not a single activity or action that will ease the effects of stress and prevent provider burnout. You have to do the work to find what best suits you. If you notice a colleague having some trouble dealing with stress, talk to them. Let them know that you're there for them, and even share what works for you. Caring for and helping patients is rewarding, but you must care for and help yourself to effectively help your patients. You are important too. Know the signs to help prevent burnout. We are all in this together. Stay safe and stay strong.